another important information that I'm going to share with you as your lactation consultant, because I know for a fact that there are so many moms right now who really struggled with milk supply. Okay, milk supply is one of the most common problems in our breastfeeding clinic. For how many years I've been dealing with moms really struggling with milk supply. Now, we know how important it is breastfeeding. Breastfeeding is one of the first nurturing, bonding interaction between the mom and the baby. Okay, especially when you're doing skin to skin, it is one of the best nurturing act when you're doing it with your baby. And when you're breastfeeding, you can give tons of benefits to your baby. And most moms are aiming for those old benefits that they can give to their baby. Now, how can you get all those benefits when you don't have enough milk? And the benefits that I'm talking about are those benefits that the content components of your milk, there's anti-pathogen that would really protect the baby from getting infections. Baby will be healthier. Baby, it also prevents obesity, overweight babies. We know for a fact that babies from newborn to 6 months, the most common cause of death is infection. Okay, either respiratory infection or digestive infection, and we want to prevent that by breastfeeding. And one thing that we can get from breastfeeding is the oxytocin, the release of oxytocin. And many moms would asking me, how do I know that I have that enough oxytocin when I'm breastfeeding? So speaking of oxytocin, we know that some of you probably, the oxytocin always comes from at the back of our head where the hypothalamus is. That's where the oxytocin comes from. Now, how can you get that oxytocin when you're breastfeeding? When you're breastfeeding, the minute the baby starts sucking and triggering those nerves in our breast, that signals that hypothalamus to release that oxytocin hormone. And that oxytocin hormone is like a relaxing, feeling good hormone that you release when you're breastfeeding. And that oxytocin hormone would also lower your cortisol level of hormone. And that's cortisol, remember, that's the stress hormone. It lowers that. Some moms who have, it also helps to promote good digestion and metabolism when you are breastfeeding. That's why it says when you're breastfeeding, it's easier for you to lose weight when you're breastfeeding, because the metabolism, the digestive system works well when you're breastfeeding. And when you're, let's say, you just give birth and you latch the baby right away and you're breastfeeding, normally, as soon as the baby is sucking and latching, your uterus contracts, and that contraction of the uterus would really prevent you from losing so much blood after you give birth. So it prevents hemorrhoids. So we want that breastfeeding to be initiated right away after you give birth. And we want that milk supply we want to build that milk supply during the first even few days after you give birth. But for some moms, for some reason, they really struggled with the milk supply. That there were some moms in our clinic that just begging, crying on what they can do to increase that milk supply. Now, it's really how we frequently breastfeed our babies, and it's how physically and mentally healthy you are too, okay? Because your physical health would really affect on how you produce milk. The milk supply can also be affected when you have poor nutrition, okay? When you don't have enough sleep, when you don't have enough rest, when you don't have enough support, when you don't have enough time to breastfeed, when you're rushing all the time, and the worst thing is, The milk supply can always be affected if you prioritize more on the formula as compared to your breast. And some moms would say, I have no choice. I have to feed more of the formula because I'm working, or I have this and that, and I cannot breastfeed all the time. So this one gets compromised, and some moms doesn't understand that if you miss a feeding or 2 feedings during the day, and you do that one maybe twice a week, maybe thrice a week, your milk will truly slowly decline because of this missing hours that you were not able to breastfeed. And moms would say, saying, okay, it's been a week, it's been a month, and my milk supply is still not established, because you are not frequently breastfeeding. Or you may be frequently breastfeeding, but the baby is not latching deeply. There's a big difference. You're breastfeeding frequently, but yet the baby's latch is shallow. And some moms, sometimes you cannot identify that I know the baby is latching, but I know I frequently breastfeed my baby, but why is it my milk supply is still very low? Latching can really affect on how you produce the milk, on how you build your milk supply. So every time you latch your baby, you need to ensure that you're checking how the lips is forming while the baby is sucking. Is it really flanged out? Is the latch really deep? Can you feel the baby's gum sucking into your, causing pressure into your nipple area? That means the latch is shallow. So even though you're breastfeeding for 20 minutes or 30 minutes, and you think, and you feel like you've been doing it frequently, but yet your milk supply isn't established, I think it's the latch problem. Now, if it's not the latch problem, if it's not really, then there's something else. Maybe you are not feeding the baby until your breast is empty. Again, the minute you keep emptying that breast, if you empty this breast every time you latch the baby, if you let the baby really empty it out, that when you feel it, it's really soft, and you feel it that the baby is really full and satisfied, then the refilling would be really, really excellent. Refilling meanings after 1 hour, your milk will refill when the baby's empty it. Because you know why? Every time when you leave something in your breast, maybe half of the breast is not fully empty, you switch around and always doing half, not fully emptying it, your milk, based on research, will slowly decline. And some moms don't realize that. They think they're doing the right thing. They're breastfeeding left and right. They know baby did for 20 or 30 minutes, but yet, where's my milk supply? So again, it's not just physically, it's not just mentally, it is also between the baby and you, on how the baby is latching, on how the baby is sucking, how the baby is emptying your breast, and how are you doing it frequently? How often are you doing it? Okay. Now, some moms would do after breastfeeding just to really boost their supply. They do power pumping after a breastfeed. Sometimes you get exhausted, and when you get exhausted, you get so tired, you feel like you don't have energy anymore. So how can you condition your body to build that milk supply when you're always tired, when you're exhausted? It's just not gonna happen that easy. So what you can do when your supply is really low, and you did the things that I just mentioned, frequently you breastfeed, you check your latch, you eat healthy, and still you're not getting it. Maybe you need to see a doctor. Maybe the doctor will be able to give you a prescription on how to increase your milk. And be very careful, be very careful, because there are some medications that you pay so much money, but yet it doesn't work for you. So if you want to take some medication to increase your milk supply right now, I would suggest don't buy too much of that medication yet. Maybe observe yourself, maybe within a week or 2 weeks. And again, just the thought, you're taking that medication and you're thinking, oh, my milk supply is gonna boost now because I'm taking this medication. But you are not really frequently doing a good job in latching this baby and maybe pumping maybe 2 or 3 times in a day to boost it. That medication gonna be useless, okay? It costs so much money, and then it's gonna be useless because you are not supporting it with the pumping and emptying your breast. So again, it's a lot of work for those moms that I've seen in our clinic who really struggle with milk supply. Milk supply is really, really devastating for some moms. Sometimes they just quit. They just take the bottle right away because they feel hopeless and helpless because they tried so many things and it did not work. I would suggest do the natural way first before you even see your doctor to get a prescription, okay? Maybe the first thing you can do is, again, check the latch, okay? Latch is what I normally check when the mom complains to me in our clinic that I don't have enough milk. I check that, okay? Now, if you feel like the latch was good, then how often are you doing it, okay? Are you really emptying your breast? Are you really, really massaging your breast and expressing it sometimes or pumping it maybe after an hour when the baby is done feeding? Those things can really boost your milk, okay? And another thing, if you haven't seen my videos of this food that can really increase your milk supply, go back later and watch that video because I pointed out so many good food, delicious food that would really increase your milk. You do the organic thing first, the non-pharmacological. Then if things still not working for you, then that's the time you're gonna see your doctor and say, doctor, I need your help. I may need a medication to increase my milk. But however, you need to read the side effects of this medication, okay? I mentioned that before because every medication that we take, there's always little, minute, or maybe slightly side effects that can really sometimes affect our body, okay? Thanks for watching. I know you learned something from this video. Please do subscribe, like this video. You can share this video because it is important. So many moms right now really struggling to have that abundant milk supply, especially the formula prices right now is over the moon, over the sky. It's so expensive. So the more we can help those moms who really needs our help to boost your milk supply, this is what we need right now. That's why I'm doing these videos to help you how you can maintain breastfeeding and make that baby happy. So I hope you're happy. I hope you're content. Play it easy, you know. Do not be feeling stressed if this is happening to you, that you have low milk supply. Just continue and improve what you've been doing in the past and maybe add a little bit effort to make sure you're massaging it while you're pumping, or even if the baby is latching, try to massage it to increase the flow, trigger that letdown. So all those things can really help to boost your milk supply. So again, milk supply is life. Without your milk supply, the baby will not be healthier or be happier. So work hard on it because it is possible to increase your milk. Bye for now. Thanks for watching.